Hi everyone, Dr. Richard Tran here at Color Chiropractic in Bellingham, Washington. I'm glad to be able to see you guys today and to do this interview. Again, we do these monthly to be able to help you to get to know some of our referral partners, and I'm excited to introduce to you Jenna Anderson. She's a body worker with over 20 years of experience specializing in craniosacral therapy, but also lymphatic care and trauma release. I'm really excited to find out more about that. Her practice consists of adults, teens, as well as babies, and the business that she has is called Attune Touch. So welcome, Jenna.
Thank you. Thanks for having me. And thanks to everyone who's taking time to listen to our chat.
Yeah, great. Well, let's get started. Tell us a little bit about yourself, how you started, your healing knowledge, because I know not all body workers are designed the same way. You guys have different trainings, much like chiropractors, and yours has evolved over time. So tell us the story.
Definitely. Yeah, definitely agree with that. There's as many different um, types of craniosacral therapy, just about as there are providers of craniosacral therapy, depending on how they started out. How I started out was I was a firefighter and emergency responder, EMT in the mid 90s. I was on an assignment where we had to take off a few months every year for funding. And I was also very curious about complementary medicine, energy medicine, alternative healing. At that time, working with sick and injured people, could see the differences and how they showed up for us. I thought of each client or patient as like a 1,000 piece puzzle that I had to put together very quickly because their backgrounds, previous trauma, previous illness, previous injuries, how they grew up, what type of health they might have had in their background, what type of lifestyle they were living at the time could really affect their outcome. So I became curious about that, and I had one of these periods of time off that perfectly lined up with a massage program, an intensive in California. So I signed up for that, and I became employed right out of that program and worked for 5 years as a regular Swedish deep tissue sports massage therapist in Lake Tahoe, California.
Mm-hmm.
And then we had some life changes in my family and moved to Washington State. And I had a new baby at that time. And I had a previous injury that ended my firefighting career. And during that injury, I met a physical therapist that was doing craniosacral therapy. And they said, "Hey, can I try this on you?" And I said, "Sure." And it was interesting because I didn't feel like they were doing anything, but I could feel changes happening.
Yeah.
So I really liked that light touch and how it felt like it was affecting me on a deeper level.
Mm-hmm.
And so when I moved to Washington State, I started private tutoring locally here with Robert Bates. And his background is mostly in the Upledger lineage or Hugh Milne lineage, the heart of listening. And I started there, but I've taken many trainings with all the lineages.
Mm-hmm.
There's three main ones. The visionary is from Hugh Milne, and then there's biodynamic, which they credit Dr. Sutherland, and then there's the Upledger. So a lot of it originated in the 1800s with Andrew Stills, who actually was a cranio-osteopath, but he modeled a lot of his work off of watching Native Americans do body work.
Wow.
And so it's evolved over time. And so depending on your provider and where they've studied cranial, there's just a wide range of what they might encounter. And there's also a wide range depending on where that provider has obtained their training, because craniosacral therapy can be performed by naturopathic doctors, acupuncturists, chiropractors, and like myself, massage therapy, speech language therapist, OTs. So just depending on where their other training is, it can really determine and affect how the treatment presents itself.
Yeah. I mean, like even myself, I mean, through our practice, we do certain forms of how we learned craniosacral therapy, but it's very different from the way that I've seen craniosacral therapists use it. At the same time, I'd like you to speak to the underlying principles behind cranial sacral therapy and how it can be used for various conditions, various modalities. Yeah.
So that's a great question. And where I sit today and where from, the training that I've had and how I think about the work that I do with my clients, my belief is that craniosacral therapy in a nutshell is practitioners working with the third rhythm in the body or fourth or fifth rhythm. So something outside of our cardiac circulation, outside of our respiratory rhythm, our breathing rhythm. There's other rhythms that initially were theoretic, even though some practitioners believe that they saw them. Dr. Upledger was one who felt that he saw the cranial pulse when he was assisting in a brainstem surgery. But it's been pretty theoretical until recently, and now those rhythms have actually been measured in studies. So they're not theoretical anymore. There's definitely other rhythms in the body. So craniosacral therapists use those rhythms to find where soft tissue restrictions are in the body and then work with those soft tissue restrictions. That's kind of like the biomechanic approach. There's also a biodynamic approach where they're using the rhythms to just really connect with the being and support the body's self-healing capacity through gentle touch. And the way that I usually explain it to clients, how I work personally, is that I use the rhythms to find the soft tissue restrictions, and then I address those restrictions by putting light touch in certain places on the body, a lot of places around the cranium, but it can be anywhere head to toe, and just help the tissue soften. With parents, I tell them for babies, it's heat and time in the right place. It's very gentle, very non-invasive, and just supporting the body and what it needs in that moment to find its healing path.
And then do you like balance out those rhythms through, let's say, a manipulation, or is it just an intentional touch, or what is it exactly?
Yeah, there's different approaches. Some people use more will force in their work. I think at the heart of craniosacral therapy is supporting the body in its direction of ease until it unwinds itself. So it depends on who you talk to there. For my work, it's more finding the direction of ease and pausing there.
Yeah.
I also have a little bit of a myofascial approach. So, working with that connective tissue, it takes more time to soften than like a typical stretch. It can be 3 to 5 minutes or longer to find the place where you have the release, and then supporting it a little longer so that the release will hold longer. It can recoil if you come off of the release too soon.
I see.
So it can be very slow, gentle practice.
I love how you describe it too. Sometimes I run into healers, I feel like they could just be chiropractors because it's a very chiropractic philosophy of the body being in a state of ease instead of dysfunction or dis-ease, which leads to disease, right? And, probably one of the biggest things that I know that you and I talked about is trauma, and there's trauma release areas. I mean, you being a paramedic, seeing all these trauma cases, trauma work is a big thing. So how do you go about releasing that through something like the craniosacral or the trauma release work that you do?
Yeah, that's a great question. I feel like that could be a talk all in itself. So under my bodywork license, as a licensed massage therapist, I get referrals from people with license to diagnose. So I might get a referral from a doctor or from a mental health practitioner for some of the other modalities I do that can help people with trauma. I don't claim that I release trauma myself, but I support clients with tools that help them on their journey of releasing trauma. The one of my modalities, tension and trauma releasing exercises, that's in the name, and it's a global certification that I have, and it does help people learn exercises and stretches that can help them activate like body-led shaking that can help them shake out tension on their own. It's very gentle, but sometimes it can be vigorous depending on what they need. And so I teach them mainly to listen to their body and the subtle cues of like when they might need a break, when they might need to stop, how to tone it down, how to focus focus it, how to bring it more global if that's what's needed. So through that, it can help them along their journey. And I do get clients sometimes that are self-proclaimed survivors of trauma, but I wouldn't put that label on someone. I just work with them however they show up with the tools that I have within my scope. Yeah, there's also the Safe and Sound Protocol listening therapy. So this was developed by Dr. Stephen Porges. Not everybody knows who he is, but most people that work with trauma do. He's the founder of the polyvagal theory, which is a theory that it's a model that a lot of people work with when working with these cases to help their clients stay in a therapeutic edge. If they are getting too stressed or too much in a memory of what had happened to them in their process, it can be actually re-traumatizing and hard on the system. So in polyvagal, we're looking to stay within certain parameters to keep it more therapeutic.
Jenna, how can people find out more about you?
www.attunetouch.com, ATUNETOUCH.com. And then if they, had questions, they can always message me through there. The absolute best way to reach me right now is through text message. So my number is 360-393-9923. And for most of this work, it's useful to try a session and see how it goes for you. If the person has been dealing with something long-term, I recommend 3 to 5 sessions because every session can be a little different, depending on how they're showing up that day, just to help them figure out how it could be useful and how they might want to fit it in with their other therapies. Most of my clients have other providers like you guys in chiropractic or naturopathic medicine, or maybe they're working with a physical therapist or an acupuncturist or a mental health provider. So trying it out and seeing how it feels for them.
Okay, wonderful. Wow, this is great. We've covered a variety of different information, and it's great to really know your background. I can see how that evolution has really led you. You've really gone from one space to the other, but everything kind of seems like they could really add a nice link to where you are today. Well, this is Dr. Richard Tran from Color Chiropractic, and this is Jenna Anderson, part of Attune Touch. And we appreciate you being here, Jenna. And again, she's one of our referral partners, and hope you enjoy this interview. Get a chance to like it, share it, and if you have any questions, let Jenna know or leave your comments or give us a call. Thanks a lot.